Good afternoon. Thank you for coming. We're about to open our news conference, and I would like to introduce Dr. Bruce Ribner, who is Director of Emory University Hospital's Serious Communicable Disease Unit. Ms. Amber Vinson, our patient, and with Ms. Vinson are members of her family, her grandparents, Mr. Lawrence Vinson Sr., Charlotte Vinson, her uncle, Lawrence Vinson, and her aunt, Cheryl Vinson. Dr. Ribner will make a statement. Amber will make a statement and will not take any questions. After Amber's statement, we will do a brief Q&A and then depart. And I would ask that you respect our patient's privacy and not shout any questions, and allow Amber and her family to depart in privacy. Thank you. Dr. Ribner?
Good afternoon, and thank you for coming today. As you've already heard, I am Bruce Ribner, and I am the Medical Director of the Serious Communicable Diseases Unit at Emory University Hospital. I lead the team of physicians, nurses, laboratory technologists, chaplains, and a host of other people who are so critically important for caring for our patients in our unit. Today I'm pleased to announce that Amber Vinson is being discharged from Emory University Hospital. After a rigorous course of treatment and thorough testing, we have determined that Ms. Vinson has recovered from her infection with Ebola virus and that she can return to her family, to the community, and to her life without any concerns about transmitting this virus to any other individuals. Speaking on behalf of everyone at Emory University Hospital, we are pleased with Ms. Vinson's recovery and grateful for our opportunity to apply our training, care, and experience in meeting her medical needs. As fellow members of the healthcare community, we deeply admire Ms. Vinson's courage and dedication in caring for patients with serious communicable diseases. Nurses are on the front lines 24 hours a day in treating our patients, and it is their skill, their knowledge, and their passion for healing that makes one of the critical differences in caring for our patients. Now that Ebola virus transmission has occurred in the United States, we all recognize that there is a lot of anxiety in the community, and that is understandable. But the American healthcare system has been able to successfully treat patients with Ebola virus disease. We have the resources, we have the expertise, and we have the knowledge. We must not let fear get in the way of our primary mission, which is caring for patients with serious diseases such as Ebola virus infection. As grateful as we are for Ms. Vinson's recovery, we do recognize that our role as the American healthcare system and our nation's role is far from over. Emory has taken a lead in posting our protocols online, as well as participating in webinars, answering myriads of phone calls and emails, and trying to spread knowledge of the management of this disease around the world. We continue to collaborate with the Centers for Disease Control and Prevention, with the National Institutes of Health, with the Food and Drug Administration, and the many professional organizations which have been involved in fighting this terrible outbreak. We also like to acknowledge the many government officials at all levels, local, state, and national, who have assisted us from the time we started to care for our first patient with Ebola virus disease. We also want to acknowledge and thank our colleagues at Texas Health Presbyterian Hospital. We have been privileged to care for one of the members of their team, and we are delighted that Ms. Vinson will be rejoining her community soon. As Mr. Dollard said, I will be answering your questions in a moment, but before I do so, Ms. Vinson would like to make a statement. She will not be taking any questions, and we ask that you respect her wishes and save your questions for me. Thank you.
Thank you, Dr. Ribner. I'm so grateful to be well, and first and foremost, I want to thank God. I sincerely believe that with God, all things are possible. While the skill and dedication of the doctors, nurses, and others who have taken care of me have obviously led to my recovery, it has been God's love that has truly carried my family and me through this difficult time and has played such an important role in giving me hope and the strength to fight. I also want to take a moment to publicly thank my dear grandparents, my aunt, and my uncle who have been visiting me here at Emory, supporting me, and making sure I knew my family was there for me throughout my illness. And to my family who played such an important role in my recovery by being there every minute, every day, even though you couldn't be close. Mom and Derek, I want to express my love and sincere thanks. While this is a day for celebration and gratitude, I ask that we not lose focus on the thousands of families who continue to labor under the burden of this disease in West Africa. Thank you to Dr. Kent Brantley and Nancy Wrightball, both of whom were successfully treated here at Emory, for your donations of plasma for me and other patients. And thank you for your leadership in helping to educate the public about this difficult but treatable disease. I want to sincerely thank the professionals who have contributed to my care here at Emory Healthcare and at Texas Health Presbyterian Hospital, Dallas. As a nurse, and now as someone who has experienced what it's like to be cared for through a life-threatening illness, I am so appreciative and grateful for your exceptional skill, warmth, and care. Finally, my family and I would like to thank the many people whose prayers have helped sustain us. As we head back home to Texas, we are grateful and we respectfully ask for the privacy my family and I need at this time. Thank you.
Thank you, Amber. At this time, we'll open it up for questions for Dr. Ribner. Yes, sir.
Dr. Ribner, what have you learned from the treatment of Dr. Brantley to Nancy Wrightball to Amber? Have you changed your protocols, how you treat, streamline, things of that nature?
So the question is, what have we learned from now treating successfully 4 patients with Ebola virus disease in a developed country? And the answer is we've learned a great deal. Simple things like fluid management, electrolyte management. Again, our colleagues in West Africa and also in Central Africa have treated a lot more patients with Ebola virus disease than we have. But the advantage we have is the infrastructure to really study this disease in great detail. And again, we have been feeding that back to our colleagues both in West Africa as well as around the United States as many facilities plan for potentially caring for patients with Ebola virus disease.
We've had a lot of talk over obviously the last week or two just about these quarantines in different states. Tell us why these quarantines aren't the right thing to do.
So the question is, what is the role of quarantine in managing Ebola virus disease? We recognize there's a lot of anxiety in the United States, and we think it's critically important, I think it's critically important, that we reassure the American public that we are in fact taking measures to protect them from future exposure or infection with Ebola virus disease. But I think the thing we really have to keep in mind is that the only way that we are truly going to be able to make our citizens safe is if we control the outbreak in Africa, which is having a devastating impact on those countries. And so, as we put in place various measures to try and protect citizens of this country, we have to be very mindful of any unintended consequences which may make it more difficult to manage patients in the African continent. Every state is going to have to do that very delicate balancing act with guidance from the Centers for Disease Control and Prevention and from professional societies. Emory has membership on the Governor's Task Force attempting to assist the state in making that balance for the state of Georgia.
That's it.
Dr. Whitmer, a couple of questions. Congratulations on triumphing over Ebola 4 times now.
Thank you.
You talked about a little bit about what you've learned, but I'm wondering if you've had patients with various levels of severity. I'm just wondering if you could say what you learned from that. Secondly, Ms. Vinson was declared virus-free several days ago. Could you talk about what has been going on since then? She was not discharged.
Okay, so again, the question is, what have we learned from caring for patients with multiple levels of illness associated with Ebola virus disease? And again, we have learned, as we had anticipated, for those of you who were with us back in early August when we started this adventure together, that indeed our hypotheses were correct, that the aggressive supportive care that we have learned from treating many critically ill patients at Emory University Hospital is directly applicable to patients with Ebola virus disease. The other thing that we have really changed the mindset on is how aggressive we can be with patients with Ebola virus disease. I would have to tell you that the general dogma in our industry in July was that if patients got so ill that they required dialysis or ventilator support, there was no purpose in doing those interventions because they would invariably die. I think we have shown our colleagues in the US and elsewhere that that is certainly not the case. And therefore, I think we have changed the algorithm for how aggressive we are going to be willing to be in caring for patients with Ebola virus disease. The second part of the question in terms of Ms. Vinson's health care over the last week, I obviously cannot release because of patient confidentiality issues.
Right.
Have you been able, in the course of your debriefing or treatment, to identify how she became exposed in the first place?
Okay, we are not aware of the specific details of what occurred in the Dallas facility or how transmission occurred in that environment.
Sorry.
Can you attribute her relative speedy recovery to any 1 or 2 techniques that she used, or how's her recovery been much faster than some of the previous patients?
So the question is, why did our patient recover so quickly? And a parallel question, which you probably all have noticed, is that her colleague also recovered very quickly. The honest answer is we're not exactly sure. We have a couple of hypotheses. Number one, they are 2 of the youngest patients who have been treated in developed countries for Ebola virus disease. And again, we know from a lot of data coming out of Africa that younger patients do much better than patients who are older. The other hypothesis we have is, again, that she was wearing personal protective equipment during the care of her patient in Dallas, and therefore it is quite likely that the amount of virus that she was exposed to was substantially less than what we see in patients who get infected in less developed countries. And we also know that the higher the viral load that you get infected with, the more severe your disease is likely to be.
Were We're going to take a couple of questions from a call-in line right now. Can we get those questions now?
Yes. Overall, thank you for your time. I would just like to commend the response from Emory. Overall, what is the message that you would like to get over to the public about some of the fear that really gripped us?
So the question, for those of you who may not have heard it, is what message would we like to get out to the public in terms of the anxiety and fear which is very present in the United States? And I think the message we would like to get across is that, again, this is a new virus for the American shores. This is a virus, however, which is well known, unfortunately, in Africa, where they have had 40 years of experience in dealing with it. We know the modes of transmission. This is not a virus which is very easy to acquire through casual contact or through the air. It requires exposure to blood and body fluids and close exposure. And again, as we look at measures in the United States to potentially control additional exposures that might occur, we need to keep the science in mind as we deal with other measures.
One more question from the phone line.
Thank you. David Cole from Forbes.com. Your line is now open.
Yes, Dr. Ribner, I was wondering how you folks are prioritizing which experimental treatments are given to the patients, and how are you assessing the potential for any experimental treatments, including the donations from Dr. Brantley and Ms. Wrightful. How are you assessing their contribution to the recovery of these patients?
Okay, so the question is, as we treat our patients, how do we individually decide what experimental agents might be appropriate for them, and how are we assessing their efficacy? Every one of our patients is evaluated for which of the experimental agents might be most appropriate for them. We are in constant collaboration with the Food and Drug Administration, with our colleagues at the Centers for Disease Control, and also now that the experience in the developed world has become much more common, with other centers treating patients with Ebola virus disease that have the kind of infrastructure that we do. And so we don't have any magic formula on a case-by-case basis. We look at the agents that are available, we look at the patient's setting, we look at the viral loads and lots of other clinical factors, and then we make an individualized decision. In terms of evaluating efficacy, clearly we can't do that in these one-of episodes for each one of the patients we treat. We do get a little bit of a feel for safety data because, again, many of these agents have never been used in human primates before, and so we do get a feel for what kinds of side effects they have. But clearly, from the extremely small numbers we have no ability to determine efficacy. We are in collaboration with the National Institutes of Health and with other treating centers around the world in an attempt to try and develop the kinds of protocols which will answer those questions.
Thank you very much. As you can imagine, this has been a big day for the Vinson family, and we're going to let them be on their way at this time. So thank you very much.
Now I gotta leave.